Hey everyone, my name's Joseph and this is my latest YouTube update all about my Achilles rupture recovery process, and this is my update for week 5 to 6. Let's get into it. So this has been probably the most mentally challenging couple of weeks, apart from maybe the first week. So last week was my 5th week, and the Sunday, exactly 5 weeks after I did my Achilles, I came off my blood thinners, so my injection blood thinners that I was doing for about 28 days I had, and then I had a physio appointment on the Monday, and a really positive physio appointment where the physio did like a Thompson test, and actually you have to squeeze pretty hard to to do a proper Thompson test, so which is something I haven't done at home. But the physio did a proper test, and he said, yep, the tendon is attaching nicely, and he can see my calf and my ankle kind of twitching when he did it. So that personally was like really great news, and he was also kind of introducing me to like range of motion exercises. So if I show you a few exercises that he's shown me to do, so this is my foot here with the sock. So really easy sort of bringing my toes up, down, up, down. So until I feel a stretch in the back of the Achilles. Also sort of circles like this. So I'm just kind of doing them easily like this here, and the other way, and also doing kind of like toe kind of curls like this, which actually feels really nice. When your foot's in a boot all day, just stretching the bottom of your foot out, that's really nice. So these are really easy range of motion exercises to do, and he advised me to sort of do them a few times a day, basically, just to get the foot moving and the mobility moving. And in actual fact, like it was great seeing him, because he gave me a lot of confidence that I could move my foot, because up till then I was pretty scared to move my foot around, and let alone move it like this and like this. So it was a real confidence booster seeing him and having kind of the green light to start actually using my foot and start activating the muscles, because ultimately your foot is asleep in the boot, and all these small muscles are around your foot and your ankle. They're kind of just going to sleep, and you need to kind of wake them up a bit, because it's not just your Achilles tendon that obviously that's trying to heal, but your whole foot and calf mechanism needs to recover from this injury. So but overall that was a really great session with him, and it put me off to a great start last week. But unfortunately, I had a bit of a setback last week, and the Tuesday, the day after I saw the physio, I started getting this ache in my calf, in the kind of fatty bit of the calf, and I really felt it when I was standing up and walking, and it would only be relieved when I would elevate my foot. And I immediately knew that it wasn't a normal pain. Immediately I knew that this was a bit different. It wasn't really painful, but I knew it was unusual. So on the Thursday, I decided to go to the NHS A&E department near me in the hospital, and just to get it checked out, basically, because I was worried that it was a clot or a DVT, which obviously with this injury, you are at a high risk of a DVT, because your foot is immobilized and your calf isn't doing the pumping mechanism that helps to basically drain the veins in your lower leg. So I went there and they did a blood test immediately, and they looked for a chemical called, well, not a chemical, but a kind of, I think it's a protein called D-dimer. And if that's elevated, then it shows, not completely comprehensively, but it indicates that there may be a clot forming in your leg, because it's like a fiber that's being created by your body when clots are formed. So that was raised, and they said to me, okay, we don't know for sure that it's a clot, but we have to treat you like it is a clot. So they immediately put me on rivaroxaban, which is a anticoagulant medicine. It's 2 tablets a day, and I've got 3 weeks of that. So that was last Thursday. I was given three prescribed 3 weeks of that medicine. And then meanwhile, they booked me in for an ultrasound scan, which would show definitively if I had a clot. And that was booked for the week that has just gone. So I went to the hospital on this week, just gone, on Wednesday. And they did a scan that went from my groin, so the big vein, obviously sort of going in the groin, down the leg. So they scanned all down my leg, into the different veins around my calf as well. And so the radiographer said, yep, so you've got a thrombosis in a sort of deep vein on the outside of your calf. So yeah, that wasn't great news. Not great news to hear, but I kind of was suspecting it because, yeah, the pain that I had the week before was unusual. And although the pain had subsided by the time I'd got to my scan about a week later, probably due to the inflammation had gone down and I was on the blood thinners. But anyway, the scan showed that, and then I saw a doctor and they just said, yeah, well, we have to prescribe you now with 3 months of blood thinner medicine, just to clear up the clot for good. And they also said that they don't do a follow-up scan to, well, show. So I did ask. I was like, well, how do you know it's gone? And they just said, well, if you have any more symptoms, come and see us. But otherwise, it just clears up by itself. Or they seem to, that's the case basically. They say it clears up by itself, and you're good to sort of just live as normally, basically. So yeah, that was this. So the last 2 weeks, I have been, to be honest, not worried about my Achilles. I've not been worried about my Achilles at all because I've been doing my exercises, I've been moving it about. That's all we can do, right, at this stage. I've been increasing the mobility of it. I've been putting more weight on it, walking, crutches, putting more weight on it and all of that good stuff. And it's actually been the DVT clot thing that was all in my head the last 2 weeks. And yeah, it's been kind of stressful because initially when I found out that there was a clot, I was like, Jesus, so, how do I know? How do I know that it's safe? You hear all these horror stories of, obviously a clot at its worst case scenario becomes a pulmonary embolism, which is where a piece of the clot breaks off and travels up your leg, up to your lungs and heart. So, I couldn't help but worry that this was like a sort of ticking time bomb inside me, and I'm just sitting here, can't do anything about it. I don't know how bad or how good it is. It's quite scary, to be honest, and it has been scary. I've been quite worried about it, and it's been kind of difficult to sort of get my head around it, to be honest with you, because I'm 32 years old, active. I've got a flipping blood clot, like, what? So anyways, that is the state of play after at the end of kind of week 6, and but basically what the upshot is, I've been given the kind of, they've just said that you can kind of do what you like you don't have to really change your sort of lifestyle that much. You just have to be aware of the symptoms of, sort of tough to breathe, heart beating, like be aware of those symptoms, obviously. But otherwise, like, it's okay to exercise, it's okay to walk. If I had a blood clot and I didn't have this injury, they would tell you to increase your exercise a bit more, so walking a bit more, and try to do a bit more stuff. So although I can't walk properly, I can just go ahead with what I was doing before with my Achilles tendon rehab, I think. So it's a bit of a difficult one, and it might throw me back, probably not 3 months, but it might throw me back a bit, because it might sort of stop me from doing maybe the more aggressive, the aggressive strengthening, perhaps. But I'm actually going to speak to the doctors on Monday again, where I will have an update from the hospital itself about my Achilles tendon. So I'm going in just for a sort of update from the orthopedic doctor, just to get an update on the tendon, and that's when I'll ask a bit more questions about, does it limit me? Does sort of the DVT clot thing and being treated for that, does that affect how I can rehab my tendon in terms of the movements and working my calf, pumping my calf, like this? Is that gonna, am I limited in terms of anything like that? So that's what I'm going to confirm on Monday. So yeah, that's the update today. So those 2 weeks I've been progressing the tendon okay, but it's actually been the least of my worries, because the clot issue was the main issue these last 2 weeks, to be honest with you. And yeah, the tendon is just going on in the background. It's kind of, as we all know, it's a slow progress, but yeah, I feel good though. Like, health-wise, I feel fine. My symptoms of this DVT have not been very obvious. Like, nothing, no big swelling, no big redness all over my leg. It's not been like that at all. So I'm not suffering really with it, touch wood, obviously. But I just have to be aware that it's there in the background, unfortunately. But we carry on, we crack on with our rehab, and yeah, staying positive, staying active, staying, committed to all the recovery work. It's just a setback, and I'm sure we all have setbacks during this long recovery process, so this is just mine at the moment. So that's it. Thanks for watching, and I'll see you next time.